Hello, my name is Gina Martella, RN. I'm a BSN student, and I'm going to be assessing Miss Hannah.
Hello.
All right, so Hannah, I'm going to ask you a couple questions about your skin.
Okay.
Do you have any past skin disease?
No.
Okay. Do you have any changes in skin color or pigmentation?
No.
All right. Any changes in a mole?
Mm-mm.
Okay. Do you have any excessive dryness or moisture?
No.
Good. Any skin itching?
No, not really.
Good. Do you have any excess bruising?
None that I've noticed.
All right. Any skin rashes or lesions?
No.
Perfect. Are you taking any medications that might be altering your skin?
No.
Okay, great. I'm going to go ahead and inspect. I'm noticing the color is the same throughout, appropriate for ethnicity. Temperature is warm and dry. Texture is smooth. Let's see, I'm not seeing any edema. Capillary refill is less than 3 seconds. Perfect. I'm going to check your turgor. Just going to pinch a little spot under your clavicle. Perfect. I see immediate recoil, which is good. Let's see, I'm going to inspect your hair. Any tenderness in your head?
No.
Okay, perfect. And the hair is soft. And the color is appropriate for age. Alright. We're going to move on and I'm going to inspect your head, face, and neck area, okay?
Okay.
So just your head, I'm going to run my fingers through your hair. The head appears to be normocephalic. Don't feel any lesions or lumps. Is there any tenderness?
No.
Alright, perfect. Do you have any history of headaches?
No.
Head injury?
No.
Any dizziness?
No.
Perfect. Any neck pain?
No.
Any lumps or swelling in the head or neck?
No.
Perfect. Alright. Okay, let's see. I don't see any deformities in the head either. The temporal artery. It's even bilaterally. I'd call it a +2. I'm going to check your temporomandibular joint. Can you open your jaw and close and open and close? There is no clicking or she doesn't get locked whenever she opens. Let's see. Sorry. I'm going to go ahead and inspect the face, facial expression. She has symmetrical eyebrows, eyes, everything is symmetrical. There's no drooping or anything. I don't see any involuntary movements, no facial edema, masses, or lesions. Color and texture is the same is consistent throughout. Let's see, neck appears symmetrical. Let's check your range of motion. Can you touch your ear to your shoulder without moving your shoulder? Perfect. And other side? Good. Can you roll forward? Perfect. And back? Perfect. Neck appears symmetrical with full range of motion. Let's see. And cervical muscles seem strong. I don't see abnormal pulsations or any thyroid enlargement. I don't see any lymph swelling, but I'll go ahead and palpate the lymph nodes. I'll start with the preauricular. Any tenderness?
No.
Go with the posterior auricular. Any tenderness there?
No.
Perfect. We'll move back to occipital. Any tenderness? Perfect. And then let's see. We're going to go to the submental. Any tenderness there?
No.
Submandibular. Perfect. Our jugulogastric is right here. Do you have any tenderness?
No.
Perfect. And superficial cervical. Don't feel any lumps or clumping or anything of her lymph nodes. Deep cervical chain. Can you turn your head towards the side? And the other side. Perfect. And then I'll check your supraclavicular. Any tenderness on any of those?
No.
All right, perfect. So all lymph nodes are without tenderness, and they're freely movable. I didn't feel any clumping of the lymph nodes. All right, and now I'll palpate your trachea. Trachea is midline. Now we'll palpate the thyroid. Feel it from behind. Moves easy from side to side. Can you swallow for me? Perfect. And trachea, sorry, the thyroid moved up with swallow, so that's perfect. Looks good so far.
Good.
All right. Now I'm going to ask you some questions about your eyes.
Okay.
Do you have any difficulty seeing or blurring?
No.
Good. Any eye pain?
No.
Any history of crossed eyes?
No.
Perfect. Any swelling in the eyes?
No.
Watering or tearing?
No.
Good. Any injury to the eyes?
No.
Okay. Do you wear glasses?
No.
Perfect. Have you ever been tested for glaucoma?
Yes.
Okay. And that was negative, I'm guessing?
Yes.
All right. Perfect. All right. Let's go ahead and check your visual acuity. So we have a Snellen chart over here.
Okay.
Here's the Snellen chart, and we have checked what is 20 feet away. Gonna have Hannah cover one of her eyes. All right. And you say you have pretty good vision?
That's what I've been told.
All right, let's start right here. And read this line for me.
E, D, F, C, Z, P.
Perfect. Can you go down here?
F, E, L, O, P, Z, D.
Good. Can you move the next one?
D, E, F, P, O, T, E, C.
Great. Can you try this one?
L, E, F, C, P, F, C, T.
Okay, missed a couple there, but looks like you're 20/20 in the left eye. So go ahead and switch eyes. All right, let's try this one here.
F, E, L, O, P, C, D.
Good. Go down here.
My eye's kind of blurry. Close, just a moment.
All right.
D, E, F, P, O, T, E, C.
Good. Can we go down to this one?
L, E, F, O, D, F, C, T.
Perfect. Well, you missed a couple on that one, so we'll say you have 20/20 vision in both
Okay.
eyes. So go ahead and have a seat for me, Miss Hannah. All right. I'm going to have you read something.
Okay.
I'm just going to hold this about 14 inches away.
Okay.
Can you read this first line here?
Small vesicles containing blood on the drum, accompanying mycoplasma pneumonia and virus infections.
Well, that was great. Thank you. All right. So we're going to say your visual acuity is pretty good. Let's test your visual fields. I'm going to have you look at me in the eyes, and I'm going to bring my fingers around. Once you see my fingers, go ahead and let me know.
Okay. There. 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 There.
Good. Good. Looks like she has good peripheral vision. Now we're going to inspect the extraocular muscle function with the corneal light reflex. All right, I'm going to shine a light and see if I can see the light equally on both pupils. All right, looks like they're both at about 2 o'clock in each eye, so she has good corneal light reflex. Now we'll do the cover test. I'm going to cover one eye. You just look straight at me, okay?
Okay.
Perfect. And her gaze stayed fixed the entire time on my eyes. And now we're going to do a diagnostic positions test. We're going to do 6 positions, so just follow my finger.
Okay.
we're going to inspect the external eye structure. Her eyebrows are evenly distributed, eyelashes are evenly distributed on both eyes, they are symmetrical. Let's see, the conjunctiva is pink. Looks pink and moist, and the same on both sides. The sclera is white. Let's see. We're going to inspect the anterior eyeball structure with this light here. Okay, I'm going to have you look at pick a spot on the door, and I'm going to shine a light into your eyes. Okay. Perfect. All right, now keep looking over there. Now look at the light and back at the spot. Perfect. Her pupils were equal and reactive to light and accommodation. Now I'm going to inspect the ocular fundus with this ophthalmoscope. All right, I'm going to dim the lights for this one. All right, I'm going to be observing the optic disc, vessels, general background, and the macula. I can visualize the vessels, they're red, the general appearance is orange-red color, the optic disc is round. It appears to be equal on both sides. Left side is also an orange color. Let's see, the vessels are red. Alright, we're going to move on to your ears. Do you have any issues with earaches or pain?
No.
Good. Do you have any ear infections?
No.
Do you have any discharge from your ears?
No.
Do you have any hearing loss?
No.
Do you have any ringing in your ears?
No.
Perfect. Any vertigo?
No.
That spinning of the room? Perfect. Okay, I'm going to inspect the external ear. They appear to be symmetrical on both sides. The skin color is consistent with the rest. They're warm. Any tenderness whenever I pull on them?
No.
The pinna is intact without tenderness. I'm going to go ahead and inspect with an otoscope. I'm going to pull up and back on the pinna and look at the tympanic membrane. Alright, we'll go to the other side. Bilaterally, the tympanic membrane appears round. It's an opaque in color. It's flat and it appears to be pulled in the middle. Let's see. Right. I'm going to do a whispered voice test on you. So if you just cover one ear by pushing the tragus, then I'm going to whisper 3 numbers and you just tell me what they are, okay?
5, 7, 9.
Perfect. I'll cover the other ear. I'm going to say a sport. Sorry.
Baseball.
Baseball. Perfect. All right. Let's see. We're going to move on to your nose. Do you have any issues with nasal discharge?
No.
Okay. Do you have any sinus pain?
No.
All right. Any trauma to the nose? Issues with nosebleeds?
No.
How about allergies?
Only seasonal.
Okay, perfect. All right. Any pain whenever I palpate the nose?
No.
I'm gonna look into the nose. Change my thing so we stay clean. appears to be reddish pink in color. I don't see any swelling or foreign bodies. I'm going to test the patency of each nostril. Can you breathe in for me? Good. The other side. Good. I do not see a deviated septum. It looks midline. I'm going to palpate the sinus area. You tell me if you have any pain.
Okay.
All right, good. Any pain?
Mm-mm.
Okay, I'm going to press here. This is the maxillary sinus. Any pain?
No.
All right, good. Perfect. All right, we're going to move on to the mouth and throat. Do you have any issues with sores in the mouth?
No.
All right. Do you have sore throat issues?
No.
Okay, any bleeding gums?
Mm-mm.
Okay. Any difficulty swallowing?
No.
All right. I'm going to inspect the mouth. The lips seem to be pink without lesion. They are moist. Let's open. And the tongue appears to be pink and moist without lesion. The buccal mucosa is pink and moist without lesion. Can you stick your tongue out and say, oh? There are no tonsils present. This is normal finding for her. And it looks pink without lesion or any kind of mucus buildup or white spots or anything. So the throat looks good. All right. And uvula is intact as well. All right, we're going to move on to the thorax and lungs. Do you have any issues with cough?
No.
Shortness of breath?
No.
Okay, good. Do you have any history of lung disease?
No.
Good. Do you smoke cigarettes?
No.
Good. Let's keep it that way. I'm going to turn this light back on. All right. I'm going to go ahead and inspect the thoracic cage. Hannah's thoracic cage appears to be an elliptical shape with downward sloping of the ribs, and it is symmetric. Let's see. She seems to be in a normal position and she's not struggling to breathe. The respiratory rate and pattern seems normal without any distress. Regular rate and rhythm on her, and regular pattern as well. She is awake and alert and does not appear to be in any distress when she's trying to breathe. All right, so I'm going to palpate for symmetric chest expansion. So if you can lean forward for me, Miss Hannah, I'm going to put my thumbs at around T9. Pinch a little skin in between. Can you take a deep breath for me? And out. Good. It appears she has symmetric expansion. All right. And we're going to check for tactile phrenitis by feeling for vibrations. So can you say the phrase 99?
99.
And again?
99.
And again?
99.
And again?
99.
And again?
99.
And again.
99.
Perfect. The vibrations feel regular throughout. All right. Now I'm going to percuss. I'm going to start at the apices and listen for the vibrations and compare on each side. Vibrations seem to be the same on both sides. And let's see, the diaphragmatic excursion seemed to start right around T9 or T10, which is a normal finding. I'm going to go ahead and auscultate. I'll start with the posterior. I have 9 different spots I'm going to listen. So Hannah, if you can just take a deep breath every time I move my stethoscope, that would be great. So go ahead. Perfect. And again. listen to the posterior and the lateral. Now I'm going to listen to her anterior. Deep breath for me. Another one. Another one. Way down. Okay, deep breath. And one more. Perfect. All right, lungs seem to have bronchovesicular sounds throughout, except in the top she had some bronchial sounds, and towards the bottom she had more vesicular sounds, but they were all clear throughout. We're going to move to the cardiovascular system. Do you have any issues with chest pain?
No.
Good. Shortness of breath? Any cough?
No.
Any swelling in the feet or legs?
No.
Do you tire easily?
No.
Okay, great. So I'm going to go ahead and assess your carotid arteries. One at a time. They are palpable and regular. I'd call them a +2 on both sides. I don't see any jugular venous distension on either side. No abnormal pulsations. I'm going to go ahead and look for any chest wall pulsations. I'm palpating for chest wall pulsations, and I do not feel any on Hannah. All right, now I'm going to go ahead and listen. Start on the right. About a second. Hannah has a regular rate and rhythm with S1, S2 heart sounds. I did not hear any kind of murmur. Okay, now we're going to check your peripheral vascular system. Do you have any issues with leg pain?
No.
Good. Any skin changes in your arms or legs?
No.
Any swelling in legs?
No.
Good. Any swollen glands?
No.
Okay, I'm going to inspect the arms. The color is the same on both. I'm not noticing any edema. Nail beds have an immediate capillary refill, so that's good. And then, let's see. I'm going to go ahead and inspect your legs now. The color is consistent with the skin throughout. We'll check for tibial edema. Good. I'm going to feel pulses. I'm going to do the posterior tibial pulse. All right, and then we're going to do the popliteal pulse. Check the dorsalis pedis pulse. Alright, she has +2 pulses bilaterally. Not noticing any edema and no discolorations. And let's see. I think we've covered everything. So Hannah seems to be within defined limits throughout, and that is my assessment video. Thank you very much.